Hi everybody, this is Marilyn from PetChatNYC.com. We're here with in our series, Meet the Experts. We're here with Dr. Jones to discuss a very, very serious and important matter, so listen closely. It's the blockage in male cats. It can be deadly. So let's hear what Dr. Jones has to say, so pay close attention. Here, Dr. Jones.
Hey guys, this is Dr. Jones over here at the West Village Veterinary Hospital here in Chelsea, West Village area. Over here on 75 8th Avenue, I'd like to talk to you a bit about one of the most common emergencies we see here called the blocked cat emergency. So what usually happens is, this is something that we see and this is along the same lines as urinary tract infections. This is particularly something that we see in male cats that are neutered. What happens is they will go to the litter box, and if you see, this is very important, this is what you need to look for. They will go to the litter box and try to urinate, but nothing will come out. They'll go in and out of the box and cry. They'll try to urinate, nothing will come out. It'll just maybe be a few drops of urine or blood. If your cat is urinating, bring your kitty cat down, and we will determine if we actually have a physical obstruction, or we're not yet blocked yet, or it's just a urinary tract infection. What will outside of the box, that's not as serious of an emergency as them not urinating at all and urinating blood. What we do expect, or what we consider when we have a cat that's straining in the litter box crying and we have blood coming out, or they're not urinating at all, is an actual physical obstruction in the urinary tract. So this is most often seen in, like I said, male cats, because the tube that the urine comes out of can be very narrow. So they can get like a physical blockage, and it's usually diet related. Some just because of something hereditary, certain cats have a propensity to forming a certain type of crystal that can kind of form like a plug and actually lodge in the urethra, which is the tube the urine comes out of. What you need to do if you see this as a pet owner is bring your kitty cat down, and we will determine if we actually have a physical obstruction, or we're not yet blocked yet, or it's just a urinary tract infection. What we'll typically do is, if we determine, we'll take an x-ray to see if the bladder is really big, and usually if it's really big and hard, that means there's a physical obstruction and the urine can't come out. What typically happens in that case is we admit your kitty cat to the hospital, and we pass a urinary catheter through the urethra, which is the tube that the urine comes out of, and we leave that in place. We're actually relieving the physical obstruction, and we leave the urinary catheter in place usually 24 to 48 hours. Sometimes we find that when we do take the initial x-ray, there are stones in the bladder as well. And in that case, there is a secondary surgery needed in addition to passing the catheter, where we actually go in and remove the stones out of the bladder. It's called a cystotomy. You don't really see that often, but we leave this urinary catheter in place for usually about 24 to 48 hours. We take it out and make sure that after we take it out, your kitty is able to urinate on, it's usually a male cat that he's able to urinate on his own. And if that's the case, we usually send them home with a different diet, because usually when they eat a certain type of food, that's how they have this propensity to forming a certain type of crystal, or forming this plug that actually forms the physical obstruction. So we have to change their food, and they also have to be on canned food when they leave the hospital, because like I said, that is very important in preventing further reoccurrence. In that case, have to have dry food of the prescription diet, and that's fine too. I usually try to encourage of the same issue. They can, if they're not changed to canned food, they can reblock again. There are some instances where cats will not eat canned food, and that encourage people to add water to the food. Even if it's canned, you can add water to the canned food, add water to the dry food, or encourage their water intake, because that keeps these crystals in solution and prevents them from forming an actual plug, which can cause a physical obstruction. So diet is really important. Increasing their water consumption, very, very important too for these guys. And like I will tell some people to do chicken broth or tuna water actually in their food in addition to that, to encourage their water intake. They have these great pet fountains too, which all of this in addition to the diet helps to prevent further reoccurrences. And we'll often send them home with some medicine that helps the tube that the urine comes out of kind of relax, so it's easier for them to urinate. And of course, antibiotics and pain medicine if there is an associated infection. Sometimes some kitty cats, and we've seen actually a couple cases this week, these guys will have a physical blockage, will pass a catheter, remove it, and then they'll block again within a few days. If that's the case, we say if it happens twice, we'll pass a catheter again. If it happens 3 times, we usually recommend a surgery called a perennial urethra to encourage people to add water to the food. Even if it's canned, you can add water to the canned food, add water to the dry food, or encourage. Had to do that a couple times here. And if it is suggested to you, and if your cat keeps blocking, that's probably the best bet in preventing this from happening in the future. So that's the blocked cat emergency. Along the same lines, there is something called feline lower urinary tract disease, which I will touch upon in our next segment on urinary tract disease, lower urinary tract disease. Hopefully this is helpful, guys. We'll see you soon.
Information, and remember, learning and getting knowledge about your cat can actually be life-saving. I want to thank Dr. Jones again for
You're
wonderful
welcome.
information.